Hi, my name is Callie Gallion, and today I'm going to be doing a video showing you how to insert an IV and hang fluids. So, first thing I'm going to do is I'm going to go to my computer. I'm going to look at the patient that I have, their EMR. I'm going to look to see what their name, date of birth is. I'm going to see if they have any allergies, and I'm also going to see what is being ordered today. So we have an IV that needs to be inserted, and then they have fluids that needs to be hung. So now I'm going to go gather all my supplies. While I'm gathering my supplies, I want to make sure, and throughout this video, to perform all GPSP skills, as well as my 3 med checks and my 11 med routes as well. So while I'm getting my fluids, I'm going to, of course, be seeing what the appropriateness is, any contradictions. Also, I'm going to make sure to know any precautions I should know, as well as the purpose of these fluids. I'm going to look at my bag. I'm going to check to see if there's any discoloration, any leakage, and the expiration date as well. Okay, so I'm going to get all my supplies. I'm going to knock on the door. I'm going to introduce myself. I'm going to perform hand hygiene. I'm going to ask the patient their name and date of birth. I'm going to check their wristband. Everything is right. And I'm also going to ask them one more time if they have any known allergies, just in case it was not in their chart. Okay, I'm going to explain to them what we're going to be doing today, which is they're going to be getting an IV so that they can receive some IV fluids. I'm going to let them know what the IV fluids are for as well, and answer any questions that they may have. Okay, so first thing I'm going to do is I'm going to prime my bag. Before I do that, I'm going to perform hand hygiene. I'm going to go ahead and put my gloves on while I'm doing this, just to remain clean. All right, I'm going to get my fluids ready. I've got my tubing here. Okay. All right, I'm going to make sure that it is clamped off, which it is. I'm going to open my bag of fluids. Once I do that, I'm going to open into my tubing, making sure not to touch either one, that way that we stay sterile and clean. I'm going to insert it using a twisting push method. Now, once I do that, I'm going to flip it over. I'm going to fill my chamber about halfway full. I'm going to go ahead and hang my fluids. All right, fluids are hung. Now, I'm going to take my cap off of the end. I'm going to make sure not to touch the ending of it. And I'm going to prime. I'm going to prime my tubing. So I'm going to open it up. Let a little bit of the fluid run out till there's no bubbles in the line. Cut it back off. Now I'm going to apply my tube again, or the tip of it. And then I'm going to hang it up here just to get it out of my way. Okay, so that's done. Now we are going to, I'm going to go ahead, before I start with this, I'm going to go ahead and prime my J loop as well. Now, to do this, I'm going to need my J loop. I'm going to need a saline flush. Because after we do the IV, we're gonna wanna flush it. I'm gonna take the end off. I'm gonna open an alcohol swab pad. If I can get to it. All right, there we go. Now I'm gonna scrub my hub very good. I'm gonna let it dry. Once it dries, then I'm going to apply my saline flush. And I'm just gonna push a little bit through to make sure that there's no air bubbles and it's completely primed. I'm gonna put it back in the bag though, so that we can keep it clean. Okay, so now everything's primed, ready to go. Now I just need to get my IV. So before I do that, I'm going to feel for the vein where I'm going to put it in it. If the arm was visibly soiled, of course, I would use soap and water to wash it. It is not today. Okay. All right, now before we start this, I'm gonna take these gloves off. Throw them away. I'm going to perform hand hygiene again, and I'm going to put on new gloves. So. All right, got my gloves on. Now I'm going to apply the tourniquet. Of course, once it is applied, you want to try not to take no more than 10 to 15 minutes. You don't want to leave it on longer than that. Okay, make sure my little flyaways are away from my sock. I'm going to go ahead and check my pulse just to make sure that it's still there and we're good. Okay, I'm going to take out of my IV starter kit or cleaning solution. And I'm going to scrub and back and forth method. All right, I'm going to allow that to dry. Okay, once that's dry, I'm going to open up my IV, or not my IV, yeah, my needle. Okay. Make sure the bevel side's up. Tourniquet is 3 to 4 inches from my site. I'm gonna make sure not to touch my site beforehand. I'm going to about 1 to 2 inches down. I'm going to hold the skin taut, bevel side up. I'm gonna go right over top of my vein and insert in a 10 to 15 degree angle. Okay, we've got some blood return. I'm gonna advance my catheter. Now, once I do that, I'm going to hold it steady, and I would pop this, put it in the sharps container. Okay, now I've got this stabilized, and I've also got my fingers at the end of the catheter. Now I'm going to put on my J-loop. Of course, whenever I insert the IV, I'm gonna feel kind of a pop You know, you're gonna know whenever you're inside of the vein. Okay, pop the top on this. Then I'm gonna insert. I'm gonna make sure it flushes. Okay. Now that I know that it flushes, I'm gonna take my tape, which I had already gotten off, and I'm just going to secure my hub. All right, now that the hub is secure, I'm gonna take my skin barrier wipe and take my tourniquet off. Okay, I'm gonna apply my skin barrier wipe, and I'm going to add, I'm gonna take it on. Okay, of course in real life I would take these pieces off. Now I'm gonna make sure that I time, date, the type, the size, and the size onto my IV. Okay, now I can take this off. I flushed it real good. I'm gonna go ahead and I'm gonna scrub my hub just one more time. Then I'm going to secure it down, making sure that there is no kinks in the line. Okay, I've got my IV ready. Now I am ready to add my bag of fluids. So we've already flushed the line, so I do not have to do that again because we're immediately putting our IV fluids on. Pop the top, of course, it is cleaned off. I'm just gonna go ahead and scrub my hub just one more time. You can never be too clean. I'm gonna let it dry. And then I'm going to attach, like so. Once that is attached, then I'm going to open up the flow at the correct drip rate. All right, once that is done, now I will take my gloves off. Well, clean up my area. Of course, after I clean up my area, I'm going to go back and I'm going to document everything that I just did. I'm going to make sure to come back in about 30 minutes after I've started my IV fluids to check for any infiltrates, any complications. I'm going to assess the site of my IV as well. Make sure that they're not in any type of pain. So, I believe that is it. Thank you.